Hi, welcome to the channel, and today we're going to discuss a case of a mature cataract which had been subluxated inferiorly. This is the edge of the lens over here, and this is the pupil which you see over here. And this lens is overly going downward and nasally in this patient. And this patient had trauma. And when you see the video, try to locate, see if the zonule, some stretched zonule might be visible in this patient. Well, if you have Marfan syndrome, typically the subluxation would be supratemporally, and in patients with Weil-Marchesani syndrome or homocystinuria, you will have inferior subluxation of the lens. The question will be what type of intraocular lens can we put in and what special techniques to use when you are encountered with this type of patient. So you can see the subluxation seems to be involving about, if we go on from this, if this is about 12 o'clock, this is about 3 o'clock. So this is more than 3 or 4 clock hours of subluxation you are going to have. So it is less than 6 hours of subluxation, but it is seems to be 4 or 5 uh, clock hours of subluxation. So let's see the video. If you look at the video, what we want to see is the depth of the anterior chamber. The other thing which you want to see is tremulousness of the iris, which you will definitely see in this patient. And you want to see this area where you will see these zonules. You see these lines over here. These are the stretched zonules which you see in this patient with subluxation. And if you look at the other eye of this patient, you see that there's dense nuclear sclerosis, which is about a grade NS4 nuclear sclerosis, which you see over here in this patient, and the other eye is a white mature cataract. So this patient is an old patient who developed this condition of the lens, and let's see what type of surgery we can do. This is just to show you if you've got a significant subluxation which involves more than 6 clock hours, you can put an Asioni ring. You can see this is a special type of capsular tension ring which has got an eyelet which can be sutured to the sclera like a scleral fixation, and you can therefore thereby sort of fixate the capsular bag rather than fixating the IOL. So this is superior to doing a capsular scleral fixation, in which you can fixate the bag so that once the bag is there, there is less tilt of the lens you will get after putting in the intraocular lens compared to a scleral fixation IOL. So if the take-home message is, so the degree of zonular dehiscence is superior and up to 4 clock hours, the first choice is a CTR with an IOL implantation. But because the gravity is not working over there, you can still implant a haptic being used to stretch the bag. So you can put one haptic at 6 o'clock and other at 12 o'clock to sort of stretch that capsule, and that will remain stable. But if there's inferior up to 3 clocks, CTR with IOL implantation is a must, and anywhere greater than 3 to 6 clock hours, modified CTR with a single loop, and anywhere 6 to 9 clock hours, modified CTR with a double loop with IOL implantation. As I showed you, these are the two types of Sioni rings with which either you can have a single eyelet loop or you can have two eyelets to fixate the intraocular lens. So these are the challenges which you face in these cases, and this is how you can solve them in an algorithm. Thank you very much for watching, and I hope you like the channel. Thank you.